Article 14 is safety and health. Part of it protects you, clean shops, free gear, a joint safety committee. The other part, Exhibit 1, is drug and alcohol testing, and it can end a career. The company agrees to keep shops safe, sanitary, and healthful, with first aid equipment on every shift. Required safety devices are furnished to you, and you must use them. Acids and chemicals mean aprons, gloves, and shoes. Memorize this one. Report an unsafe condition or potential hazard, and you cannot be disciplined for it. But read it closely. It protects reporting. Article 14 gives you no written right to walk off an unsafe job. The procedure for getting moved off hazardous work lives in company safety policy, not in this agreement, which means it is enforced differently. Once you report it, a clock starts on them. 30 days from being informed about an unsafe condition to respond. Note the date you reported it. Every location with represented employees has a joint safety action team. Union members serve in an advisory capacity and get time without loss of pay to investigate. Nothing they decide blocks a grievance under Articles 19 and 20. Now Exhibit 1. FAA and DOT rules make you subject to random, reasonable cause, post-accident, return to duty, and follow-up testing. Company policy adds post-mishap and no notice. Reasonable cause must rest on articulable observations of your appearance, behavior, or speech. If a test comes back verified positive, the short deadlines are yours. 72 hours to request a retest of the split specimen, at your cost. 5 days to prove unknowing ingestion. Refusing any part of a test counts as a positive. A verified confirmed positive, or breath alcohol of 0.04 or above, and you're pulled from duty without pay. On a first occasion, you get 2 options: resign with no eligibility for rehire, or be discharged, with conditional reinstatement under a last chance agreement. Read this twice. Rehabilitation is directed by a substance abuse professional, but funded entirely by you. You sign an undated resignation letter they can use. Monthly EAP contact for up to 60 months. Fail to comply and discharge results with no grievance permitted. Below the threshold, there's still a ladder. 0.02 to 0.039 may send you to EAP, and EAP alone decides if it becomes a mandatory referral. Cooperate fully and you avoid discipline. But after 1 alcohol positive, a later 0.04 bars you from safety-sensitive work for good. 2 things cut your way. A random test that interferes with your schedule can't cost you pay, and a reasonable cause test that comes back negative pays your shifts in full. Before any positive, you can self-refer to EAP using sick leave. So report hazards freely, use the safety action team, and wear what they hand you. And no Exhibit 1 cold, short deadlines, permanent outcomes. Article 14 starts on page 109.